Prime Minister, I thank you for the invitation. Since January 2020, when it became evident that the dreaded coronavirus was being transmitted globally, we did not wait until it reached our shores to begin our preparations to combat it. Prior to its arrival at our shores, we began a robust education program on the viral disease for all levels of healthcare workers and procured essential resources. We were continually informed by the science about the evolving COVID-19 disease and considered the advice of authoritative sources such as the World Health Organization and PAHO and CARPHA, as well as the CDC. And later in March 2020, when the virus was declared a pandemic by the WHO and St Kitts and Nevis recorded its first case, the Federation was fairly well prepared to combat the challenge. With the assistance of PAHO, we developed a strategic preparedness and response plan to the COVID-19, with the overall goals being to mitigate outbreaks and transmission, to protect the vulnerable populations, and to minimize the impact of the pandemic on our health systems and socio-economic activities. The Ministry's Health Emergency Operating Center, which had been established previously from funds from the immediate past budget, and which also included our emergency 311 hotline, was commissioned and became the hub for the ministry to contain the virus. We basically restructured our health sector at both the primary and tertiary level to provide the required infrastructure to contain the virus. And I dare say we did so successfully. We encouraged, and at this juncture, I wish to publicly commend all our residents and citizens who have been complying with the non-pharmaceutical protocols, including frequent hand washing, meticulous respiratory hygiene, consistent wearing of masks, and physical and social distances as advocated by our healthcare team to combat the virus, as the Federation awaited a safe vaccine. I wish to also commend the staff of the Ministry of Health, particularly the members of the HEOC and other frontline health workers, for their dedication, bravery in managing the virus thus far. It is clear that the Ministry of Health has demonstrated strong resilience and commitment in its combat of the virus, with only minimal cases of COVID-19 and no related mortality or death. I thank everyone sincerely. Truly, many opportunities arose from the pandemic. Two main ones are that we have become a more resilient people, and the other, there is now the added capacity and capability for RT-PCR testing through our main JNF hospital laboratory. The polymerase chain reaction PCR gold standard test for COVID-19, now required by many global powers who are now modeling our protocols. And fellow citizens, we also now have the COVID-19 vaccine, the Oxford AstraZeneca Covishield, and are in the process of vaccination rollout, which is the main focus of tonight's presentation. The Honorable Prime Minister announced last week that the Federation has received a significant donation of the Oxford AstraZeneca vaccine, and we expect to receive additional supplies through our procurement from the COVAX facility, other supply platforms, and generous benefactors. Consequently, we launched our national COVID-19 vaccination rollout yesterday, Monday the 22nd February, which was extremely successful and included a broad-based cross-section of key personnel. And while we would have recorded a successful launch, of significance is the fact that full and effective implementation of our plan will rely on a good governance structure, given the range of responsibilities, personnel, and the responsiveness that will be demanded as the program rolls out. In fact, we recognize the need to augment and support existing structures for the implementation of the COVID-19 vaccination program. In the public health system, a vaccination program mitigates against morbidity and mortality caused by infectious diseases at the population level. The National Immunization Program of St Kitts and Nevis is designed to provide safe, efficient, and effective administration of all necessary vaccines to the residents who indicate their willingness to receive it. The COVID-19 vaccine, therefore, will be administered as part of this existing system. Noteworthy also is the fact that relative to existing immunization programs and policies, the Ministry of Health makes policy decisions based on advice from the National Immunization Committee, which are subsequently implemented through community health services via the health centers within the Federation. The National Immunization Committee, therefore, was tasked to support the Ministry of Health and the HEOC to deliver an effective COVID-19 vaccination program that meets best practice and good governance. It is also responsible for managing vaccine procurement, storage, and distribution under validated cold chain conditions, immunization training, and providing communication materials about the vaccine to the public. This strategy aligns with the World Health Organization and the Strategic Advisory Groups of Experts, SAGE, on the vaccine program implementation. The Ministry of Health, along with the Office of the Epidemiologist, will also play a pivotal role. The epidemiological unit will collect, analyze, and publish the immunization data during the rollout of our vaccine programs in the Federation, liaise closely with our regional partners such as CARFA and PAHO, and the findings will ultimately inform further planning and policy development. Of importance also is the fact that the Ministry intends to implement a comprehensive, robust communication strategy to guide the education campaign to inform the public and generate the expected demand for the vaccine. You would have noticed that such a campaign has commenced utilizing traditional and digital media to disseminate the relevant content. Key stakeholders will be engaged to ensure success and in keeping with all of society approach adopted at the beginning of the response. I must commend the Ministry of Finance, led by the Honorable Dr. Timothy Harris, our Prime Minister, who has invested significantly in the required resources and funding in the overall COVID management, including procurement of vaccines. To date, we have invested a staggering $13.8 million, and the sum is expected to increase as we continue to procure essential supplies and vaccines. It is indeed an opportune time to convey profound gratitude to our external donors also, who include the European Union and assisted the Caribbean countries with $2 million for down payment of the COVID-19 vaccines through the COVAX facility through its Vaccine Alliance and in partnership with the Caribbean Public Health Agency, CARPHA. I must also commend the Republic of China, Taiwan, who has been a loyal friend and ally of the Federation of St Kitts and Nevis and has pledged $600,000 to assist with vaccine procurement. This gives access to vaccines that will cover up to 59% of our population. I also wish to commend the Government of India and the Commonwealth of Dominica for their generosity in the donation of vaccine, as well as the Pan American Health Organization, PAHO, for their immense technical and financial support to the Federation. With several safe and effective vaccines against COVID-19 on the market now, selecting a vaccine that is cost-effective and facilitates ease of storage will allow our health system to cover a higher percentage of the population as we aim for individual and community coverage and an appropriate herd immunity threshold, given the global demand, the global hoarding, and the fact that supply has lagged somewhat. As the Ministry of Health rolls out the vaccine, I can assure the public that all relevant logistics and storage chains are in place for the vaccine, as well as an established mechanism to track and trace all doses of the vaccine as they move through the system. I maintain that COVID-19 vaccine safety surveillance and pharmacovigilance are central to our vaccination rollout, and indeed the safety of the vaccines, staff, and consumers is paramount. I urge all citizens to take the vaccine. Thank you.
And thank you so much, Dr. Delores Stapleton.